Fires, earthquakes, and flooding. The Sacramento region is not immune to these threats and has faced some of them in the past. In disasters, citizens frequently want to assist in the emergency response. But what about a public health emergency? Is there something members of the local community can do to help out in case of a serious disease threat? Hello, I'm Don Stengel from Sacramento County Public Health, and the answer is yes, there is a way for citizens to help out during a serious public health emergency. The city's Readiness initiative allows businesses and other local organizations to assist public health officials in preparing and responding to potentially serious and even catastrophic disease threats to the community. Now, how did this program come about? The city's Readiness initiative, also known as CRI, was developed by the federal government following the anthrax attacks through the U.S. mail in 2001. Though these incidents were limited, experts say that a larger-scale aerial attack could be possible, spreading infectious anthrax spores and threatening the health of an entire metropolitan area. Antibiotics can prevent people exposed to the spores from getting sick, but the drugs must be administered within a matter of days to be effective in the majority of people. With this worst-case scenario in mind, the city's Readiness initiative has established the goal of delivering antibiotics to the entire population of Sacramento and other major metropolitan regions within 48 hours. Local public health agencies have been tasked with developing procedures for the distribution, and they would be aided by state and federal resources. In particular, a huge supply of pharmaceuticals would be made available through the Strategic National Stockpile Program to assure that enough medication could be mobilized rapidly and delivered to wherever it's needed. Even though the CRI program is based on a theoretical attack using anthrax, its principles can be applied to other public health threats for which an identified countermeasure, usually an antibiotic but possibly a vaccine, is available and could be delivered in this manner. To meet the CRI program objectives, local public health departments will need the help of many community partners. This presentation is designed to familiarize local businesses and other organizations with the concept of push partners, one of several models designed for the rapid delivery of medications to the community. Before we discuss the push partner model in detail, let's look at the various means by which medications might be distributed. In a real event, it is likely that several or possibly all of these methods might be used simultaneously. The primary method for mass medication delivery is called point of distribution, or POD. A POD is a center, most likely a large building such as a community center or gymnasium, to which the public would be directed to receive the recommended medication. If we were to rely exclusively on this method in Sacramento, we would likely need nearly 100 POD sites to meet the 48-hour time frame of the CRI program. A variation on a POD is a drive-through distribution system similar to those used by some immunization programs to administer influenza vaccine. Other approaches are being explored throughout the country, including the door-to-door delivery of medications or even pre-delivery of medications to households. Operation of a large number of POD sites would require many more resources than are currently available. In addition, it is not necessarily a good idea to increase traffic by creating large public gatherings in an emergency. It can create increased anxiety among the public. This is where your business or organization comes in. The concept of the push partners approach is to take advantage of businesses and other organized settings to receive medication from public health authorities and distribute it to employees and their clientele. In addition, medication would be distributed for use by the immediate families of those individuals. The benefits of this approach include the speed with which the medication can be distributed, the ability to pre-plan for an orderly and efficient distribution process, and a reduction in the need for public POD operations. What is the process for becoming a push partner and what is expected? First of all, becoming a push partner is completely voluntary. It is important to public health that participants feel comfortable with the program and their role in it. The process of pre-planning is designed to develop a high level of confidence that this approach is both manageable for the organization and a benefit to its employees and clients. The pre-planning process involves receiving a toolkit, which is a binder consisting of the written procedures for push partners and all of the forms that would be used in implementing the plan. The pre-planning process also includes meeting with local public health programs to review the procedures and to address any questions or concerns about the program. A lot of thought has gone into the toolkit, and many health agencies have shared their best practices. Because this is a new program, however, it is not a surprise to anyone involved to hear a question or learn about an issue that has not been raised before. Potential push partners should not be shy about raising those questions, as they will likely improve the final results. With that in mind, you may wish to consider inviting public health planners to visit your site to assist in designing a medication distribution scheme that will work for your location. An additional option would be to design a training exercise to test your individualized plan, and public health programs are happy to participate. Once your questions and concerns have been addressed and your organization feels ready to become a push partner, the next step is completion of the enrollment paperwork. This enrollment does not obligate your organization to participate, but it does create the groundwork for coordination in an event. If there is reason to withdraw from participation or to review any aspect of your relationship with public health, those adjustments can be made at any time. The enrollment process helps us estimate the number of employees and other individuals who would likely be present and eligible to receive antibiotics through each organization's site. We ask you to identify one or more points of contact to coordinate with public health. In addition, locations for delivery of medications are determined. In an actual event that requires the CRI program to be activated, the enrollment document would be used by public health to alert push partners and coordinate the delivery of pharmaceuticals to their sites. What kinds of concerns have been raised by push partners? The most frequently raised questions about this program center on liability issues. You should keep in mind that the CRI program is intended only for catastrophic events that threaten the health of the entire community. In other words, this is definitely not business as usual. Under ordinary circumstances, there are many legal requirements involved in the prescribing and dispensing of antibiotics and other medications. If the CRA plan goes into effect, there would be a declaration of a health emergency, and this would lead to the temporary waiver of certain medical practice laws and pharmacy regulations. Even though these rules exist to safeguard patients under normal circumstances, the rationale for waiving them is to make speed of the medication distribution the top priority. In other words, health officials will have determined that the need to get life-saving medication to people at risk will outweigh the small potential for adverse reactions that might have been avoided under ordinary circumstances with the usual safeguards. Public health authorities recognize that businesses and other participating push partners may incur some corporate risk as a result of participating in this program. However, many business leaders also feel that they have an obligation to plan and prepare to safeguard their employees and clients. The final decision to participate in CRI must balance the risk of taking action as an organization with the risk of relying entirely on the services operated by local government. Public health is interested in working actively toward finding solutions that will enable organizations to participate in CRI, while at the same time limiting their own liability exposure. An example of how to reduce this risk may be to register employees as disaster service workers when distributing medications at the request of public health officials. In addition, organizations may wish to take extra steps to medically pre-screen employees. That will allow them to identify in advance any reasons that certain medications should not be taken by some individuals. It also offers an opportunity to consider alternatives to the typical medications offered. Educating employees about the importance of carefully reviewing written information about any medication they receive is particularly important in a mass distribution setting. We hope that this presentation has given you a good overview of the goals and methods involved in becoming a city's Readiness Initiative push partner with public health. Here's how you can contact public health if you have questions or want to become a push partner. You can call me at area code 916-875-5881 or email me at stangeld@saccounty.net. Thanks for watching, and I hope you'll join us in our efforts to protect the community during severe public health threats.